Welcome to The Better Life with Dr. Mariane Pinkston. Join Dr. Pinkston today as she teaches you how an integrative approach to health, combining holistic and contemporary medical information, can lead you to the better life. And now, here's your host, Dr. Mariane Pinkston.
Hello, everybody. Welcome into The Better Life with Dr. Pinkston. I am Dr. Mariane Pinkston, and I'm on the radio here in San Antonio, Texas. So I do a lot of work here locally as a family practice physician. But for those of you in San Antonio who don't know, I have a podcast and a YouTube channel. And so I want to invite you, please, to come take a look and watch some of my previous shows, maybe things that you have missed if you've just tuned in and just found us over here. It is easy to find. You can go to drpbetterlife.com and find all of my links and take a look and see if you can find some subjects that you like. I talk a lot about integrative and functional medicine. I work a lot with hormone therapy. I do this at a clinic here locally in San Antonio. And also I want to give you a little heads up about something coming in July and August. I'm going to be opening a med spa. I had opened one previously, and I know everybody's got one, but I have a lot of things that are going to be very unique in regard to sexual health, but also liposuction, and it's in office and painless, called Fun Sculpting. It's absolutely amazing. So I just wanted to give you guys a heads up about a few up and coming, original, wonderful things that are going to be here in San Antonio for you. But for those of you who are tuning in podcast wise or on YouTube, I also want you to look back at some of my great shows, subscribe and share and get the word out there. I do need to talk to you guys a little bit this morning about something that a subject that I find very near and dear to my heart, that is a little unusual for most physicians. As we are trained through medical school, we learned a lot of really old-fashioned basics about the body and science and, medicines and the way things work. But as you get out of medical school, even past residency, you start to learn a lot of great science that is available to us that, we didn't learn there. And you can take on a whole new, life and niche, if you don't mind me saying that, of subjects that are not very contemporary and not very traditional, so to speak. So I have taken on one that may rub the OB-GYNs and the endocrinologists a little bit wrong, the wrong way. But there is some incredible science behind estrogen and progesterone in women's bodies. And for you guys, I want you to listen, because this could be your wife, this could be your sister, your mom, and it is called estrogen dominance and progesterone resistance. So when I got out of medical school, I went about 10 years kind of just practicing traditional medicine. I became very sick, so I developed rheumatoid arthritis, autoimmune hepatitis, and went into a lot of steroid therapies, became very obese. I was 300 pounds, very sick, diabetes, the whole works. And I also developed something called estrogen dominance. And what estrogen dominance is, if you think about a woman's body, estrogen and progesterone are just two of many hormones that are made. And they are yin and yang. So they complement each other and protect each other, keep each other at bay and watch each other and keep a nice balance in the body. When one of them goes off and takes on a life of its own, the other one gets a little subdued, or it develops more of a resistance pattern in the body. So estrogen dominance is where estrogen takes off and becomes very, very inflammatory and a big problem child. And progesterone, then your body becomes resistant to it, like insulin resistance or other resistances. So what happens with that is women develop a whole host of symptoms. So if your wife, if your mom, if your daughter, if you have had terrible problems with premenstrual syndrome, so PMS, a lot of moodiness and irritability and sadness, prior to your menstrual cycle. If you have developed very heavy periods that are long and painful and come too frequently and you pass clots and, it's a very, very difficult time of the month. Or if you go completely the opposite and have gained a lot of weight and have no periods whatsoever. You're skipping your periods for months at a time. And then suddenly you'll have one every 3 months or 6 months or so, and it's very heavy and difficult like that. If you have developed ovarian cysts, if you have developed fibroids, if you have had difficulty with infertility, endometriosis, if you've been diagnosed with PCOS or polycystic ovarian syndrome, if you have had pre-menopausal breast cancer, these are all the things that develop because of estrogen dominance in the body and progesterone resistance. Also, I left out migraines. So if you have migraine headaches, this is another very, very important one. This is all in relation to that. So when a woman comes into my practice and I listen to her history and she's giving me all of these different symptoms, and it can be in, different aspects of, each patient has their own description of what they're experiencing. And I can pick up on that basically just on a history. I can do lab work, obviously. I'm going to check and make sure that there's not something alternatively going on. But I can also look at lab work and do some ultrasounds and good testing to see what is going on. I can pick it up from estrogen levels, even if you're on birth control pills, even if you're on different types of birth control hormonally. And put all of this history in a laboratory and work up together and get this diagnosed for you. What happens in a woman, there's about, 20% of women in society that have a genetic defect, so to speak, where we don't process estrogen and hormone disruptors from the environment. So your shampoos, your makeup, your lotions, your cleaning products in the home, your candles and your air fresheners. Also, if you drink from plastic water bottles frequently, if you microwave in plastic, that's a huge one. You've heard BPA and other additives into shampoos or makeups and things into plastics. Those are the things that become hormone disruptors. So what they do is they disrupt your estrogen, making and cause estrogen to be made more in the body, but it becomes a more inflammatory type, so to speak. Of course, it's a lot more complex than this, but it becomes this way. So your levels go sky high. Progesterone, which is the yin and yang situation, is supposed to settle estrogen down and keep it at bay. So in a woman's menstrual cycle, estrogen will build the inner lining of the uterus. Progesterone will stop that building, but make it more receptive to products of conception. If there is no baby that places and begins to grow, then hormones drop at the end of the cycle and a woman has her period. If that estrogen dominance occurs and the inside of the uterus just grows and grows, progesterone isn't able to stop that. That is where the problem then lands in, and women become very sick with all of these features. So what we do is identify women. We'll start to change their diet, start to change at least help them to identify these hormone disruptors. And instead of putting them on a birth control pill, so with all due respect to most family practice, maybe internal medicine, OB-GYNs and endocrinology, whomever, with all due respect, that is not a very appropriate way in my mind, in my opinion, and based on science, to control a woman's hormones. They are synthetic, and meanwhile, you're putting this, hormone control, the synthetic hormone control in a woman's body. The symptoms of everything gets better, but the estrogen dominance and the progesterone resistance continues underneath. So the disease process is still going, and it can still form, fibroids and cysts, and you can still get migraines. In fact, if you're using birth control pills, your migraines can get worse. Birth control pills, being synthetic, can increase your risk of blood clots, your blood pressure. It can increase your risk of heart attacks and strokes and migraines, and so it's working against your body's health. And what I do, and many women, I'll step back for a second, many women will go into their OB-GYN bleeding very heavily and they become anemic. And the OB-GYN will advise them to get a hysterectomy. There are places and times for this. It's very appropriate. And I cannot step into a surgeon's decision making, and I don't want to go against your doctor and what they've advised. But it is not always the answer. You can take high-dose natural progesterone and offset that estrogen dominance while you are going to a website called ewg.org. And ewg.org it has an app and it's a website. So you can go and look up all of your products, again, from your house cleansers to candles, to makeup and lotions and shampoos and many, many different products. And look that up and see if yours is on the caution list for, boosting your estrogen dominance in your body and being a hormone disruptor, some perfumes, things like that. So you can go to that website while changing over to stainless steel and glass, watching that the caps on most things or the lining on the inside of stainless steel to prevent it from developing kind of that gooiness on the inside is a layer of BPA. So you've got to check all of your products and stop microwaving in plastic, go to glass and storing and things like that. If you make all of these changes, start eating cruciferous vegetables, so your Brussels sprouts, your broccoli, your cauliflower, and also you can take a product called DIM and chasteberry as a very natural supplement. A lot of women who do BioT, a hormone company, they recommend automatically that you do DIM and sometimes chasteberry. I don't do that automatically because natural hormone replacement, you do not always have to do a product like that. So you may be oversold, but you can take some of these products to help metabolize your estrogen correctly, but it will not lower your estrogen. So don't get confused. Doctors will give you DIM and say, okay, I'm going to lower your estrogen. No, that's not going to lower it, but it'll allow it to be metabolized a lot less inflammatory, a lot easier, and alleviate some of the symptoms. But as you do these behavioral things to change your what your products you're using and clear the blood of making more estrogen, on the flip side of that, we've got to address the progesterone resistance. So with progesterone resistance, birth control pills are made up of synthetic estrogen and synthetic progestin. So progestin and progesterone are not the same things. When you look at progestin, it is synthetic. It is not the same, made the same way. It's not the same chemical as what our bodies make. Progesterone naturally is the same, it's plant-based, and it is the same chemical makeup as what our bodies would use. Although when you go to the internet and you look up progesterone, it'll say, that you gain weight and get moody and all these issues can occur, but that is progestin, and the internet, Dr. Google, does not discern between natural and synthetic. Progesterone is real, progestin is not. So we can actually give you natural progesterone at a high dose to match what your estrogen is doing. And you may not notice much on the first month. I know many people will tell me their bleeding starts to decline, that their pelvic pain starts to improve, that their overall mood and their headaches begin to lessen. But the real success comes at month 2 and month 3. And as long as you stay on your hormone and do those environmental changes and behavioral changes, you can start to see some significant improvement. And I have had women not have to go for their hysterectomy, not have to go on birth control. And so on the flip side, in a few minutes, I'm going to talk about what birth control I actually advise that you get, because that's a little bit of a longer story. But with estrogen dominance and progesterone resistance, we are trying to get your body to behave the way that it's supposed to behave. Now, women who take progesterone and get prescribed progesterone oftentimes are sent to a local pharmacy, a commercial chain. The commercial chains, except for HEB, do not make the correct progesterone. You need to go to a compounding pharmacy. And that's why I use PD Labs, one of my sponsors, and Pharmacy Solutions. I have, HEB does as well. But all of these places are absolutely wonderful for making the right type of progesterone and can find a good price and amount for you. And that is something that is designed. It's not pre-made, pharmaceutical grade. It is designed for you and very personal. So that is the way that we can actually get your body to behave and get rid of all these issues. For those of you that transition into menopause, so if you go through hormone replacement therapy, if you are estrogen dominant going into menopause and suddenly you stop your periods, and then you go a while and then come in and I do your hormone replacement. If you start to bleed and spot and start to have problems, most doctors, most people will tell you, well, it's the hormones that you're doing. And nothing could be further from the truth. It is not the hormones. That would take years to build up the inner lining from something that is not built up. And so don't fall for that myth either, because hormone replacement therapy actually will bring to light that there is a problem underneath, because if the inner lining of your uterus grows too far, too much, for too long, it becomes cancer. And that is not due to hormone replacement, the natural therapy, the pellet therapy that I do. It is not due to that. I need to say a few things before we take this break. I'm going to take a short break in a moment. I need to say a few things about Pinnacle Clinical Research, who I visited yesterday and took very, very good care of me. I got my free fibro scan, and it was so easy. It was like, they told me it would take 10 to 15 minutes. It took actually like 3 minutes. It was amazing. And the science, as I sat with the doctor, because I got a free consultation also, and I sat with the doctor and went over my results, it was amazing, the treatment and all. And I know they're my sponsor, and they knew it was Dr. Pinkston coming in. But I've heard from my patients who go that they are wonderful. And Pinnacle Clinical Research can do a fibroscan looking for scarring of your liver, or for fatty liver disease, which we have a show on. Go back and watch me with Dr. Harrison, and you can see that show. I want to give you a little bit of information to reach them, because you can call them and make an appointment, and they can get you in very quickly. So in San Antonio, it's 210-529-7978, and in Austin, 512-601-5788, and you can just go to pinnacleresearch.com, PINNACLE research.com. And 1 in 3 middle-aged adults have fatty liver, and especially in Texas, I think our rates are a little higher. And so please give these guys a call. They are absolutely amazing. We are going to take a short break. On the other side, I'm going to talk a little bit more about estrogen dominance and progesterone resistance, and what kinds of birth control you can look at getting. Thank you.
Fatty liver is linked to 2 different situations, alcohol and diabetes, or obesity. In both cases, patients can have no symptoms. In the United States, and in particular, Texas, the most common cause of liver disease in general is non-alcoholic fatty liver. Again, associated with overweight, obesity, and/or diabetes. Additional risk factors include high cholesterol, high blood pressure, Hispanic ethnicity, and postmenopausal status. At Pinnacle Clinical Research, we offer a quick, non-invasive ultrasound-based screening assessment called FibroScan. This test is done at no cost to you, and we do not take insurance. The test will measure the fat and stiffness in your liver and stage your risk and development of fatty liver disease. You will meet with a provider immediately following your scan to go over your results. If you're interested in getting more information on your liver health, please call 210-982-0320 and schedule your FibroScan today. We are conveniently located in the Medical Center at 5109 Medical Drive.
Welcome back to The Better Life with Dr. Pinkston. I am Mariane Pinkston, and I am talking a little bit about estrogen dominance and progesterone resistance, and I've begged you guys to stick around and listen, because I think this is important for the women in your life that you know. One of the things in talking about how to handle a woman with estrogen dominance and progesterone resistance is birth control, because women don't always want to have children immediately. And so, to ask women not to do a birth control pill, or, the Depo-Provera shot, or some other types of birth control, is asking a lot, because they're very common. Most doctors, prescribe them very readily, very, very, very frequently. And it's something that I generally don't do. Even the American Academy of Gynecologists and ACOG, okay, so the Academy of Gynecologists and Obstetrics have put out a statement in the past years. defending the IUD as a very wonderful form of birth control, and it's something that I honestly like for people to use as well. But the minute I say IUD, women sitting in front of me are like, oh no, there's no way I'm going to do that. I don't want a piece of plastic in me. I don't want a baby born with a little T stuck in their head, and all these myths that happen. Now, back in the day, before you had to kind of be certified to put in IUDs, you really don't need to be certified, but they charge you and make you do that. And it's liability. I used to put in tons of IUDs. It's a very easy process, and I'm going to very admittedly say that has been my birth control choice as well, and that is what I've chosen for my daughter. And again, that's what ACOG is choosing for the younger generation as well. Your uterus is the size of your fist, so make a fist and look. The IUD is a small little T, probably about a little bit larger than quarter size, so it's really very tiny. In the base of it contains a little bit of progestin. So I just got through yelling at you about the fact that progestin is not progesterone and something we don't like. But the progestin, basically, that is in the base of this IUD, is there to help stop bleeding and also try to attempt to stop ovulation. It acts more locally, and it acts more in the area and the blood flow of the uterus, rather than being a whole systemic issue. So we advocate using the IUD, and you can put it in. It's very easy to put in. You can have a little bit of cramping with it, but there are ways to avoid that and help with that. But it is not painful. Men don't feel it. Women don't feel it. People have had them fall out. That is very rare as well. The effects are very, very low as far as risks of pregnancy, very, very low. And it is not something that is going to hurt you or cause cancer. Nobody's going to puncture through your uterus. Now, is there a chance of that happening? Sure there is. There's also a chance of lightning striking. So you have to understand these risks. We have to tell you about them, but the likelihood is very, very low. I do send to OB-GYNs here locally in order to have them done, since I'm not, quote, certified, unquote. But I've put them in before. It's a very easy process. And you can take them out and be immediately ready to have a baby and get pregnant. And it does not affect your fertility. It doesn't raise blood pressure. It doesn't cause heart attacks and strokes. It doesn't cause migraines. It doesn't worsen anything as far as weight loss or moodiness or any of those problems from, the synthetic estrogen, synthetic progesterone. And I do believe cancer risks and things like that are extremely low, because estrogen dominance and progesterone resistance can increase your risk of pre-menopausal breast cancer. There is nothing that I know of right now study-wise that says treating estrogen dominance and progesterone resistance the way that I have just described to you in all these ways prevents premenopausal breast cancer. I'm going to go out on a limb to say that I think the studies should be done, and I think they will. There is incredible amounts of science behind this. Anybody wants to argue the point, I can present that to you, and I have no problem doing so because I believe very much in it. And I do believe long-term we are going to find that it will reduce women's risk of premenopausal breast cancer. So I do jump out on a limb and say that I truly believe in that. So estrogen dominance, progesterone resistance, I think is something that's very, very important for women to understand, and to consider all the options that you have and try to improve your health and longevity. When you are having trouble with infertility, I think estrogen dominance, progesterone resistance has a large amount to do with it. I have a young lady who's a doctor here in town, actually, who had a terrible time with infertility. Straightened up her thyroid a little bit. I got her estrogen dominance under control. She got pregnant. There's never a guarantee to anything that we do as physicians, but I've worked with patients on infertility very often, and I think that this is one of the ways that if you are having problems, that you could be worked with and see some great results. Again, no guarantee, but I definitely believe in this very, very much. So we just got a couple of minutes left, guys. I want to let you know that you can reach me email-wise if you have any questions. If you have any suggestions, something you want to hear podcast-wise, please reach out to me. If you will just go to drpbetterlife.com and there's an email and a contact form. You can reach me at any time. Also, I want to thank Pinnacle Clinical Research for allowing me to be on air and to promote them, because I have autoimmune hepatitis and I had to go get that checked out, and that was a very easy, non-scary process, non-painful, and a great way. So pinnacleresearch.com. Please reach out to them. And if you need to contact me at the clinic or come to visit us here in San Antonio, 210-698-7825. And if you'll contact me on email, and I also plan to put this if I can get past the copyright, but you can also contact me, email, and I can send you some great literature on estrogen dominance and progesterone resistance. Do remember EWG.org. Take a look at that, ladies and gentlemen, and see if you can clean up your products at home. Guys, thank you very much. We will see you next week.